Hi, I'm Dr. Julie Steinauer, and I probably get this question online like every single day. Am I too old for vision therapy? Or am I too old to have my vision corrected? Or is my child too young? Well, the answer is no, and no, and no, and no, and no, and no. There is no too old or too young. Any age, actually, we can correct and train better vision. And so let's talk about on the young end of the spectrum. So on the young end of the spectrum, it's very common for us to start working with kids around the age of 3, 4, 5, or 6 months of age. So there's no age limit on the lower end in the young years as to what we can work with. Even if you say, well, but my child is 2 or my child is 3. No, still not too young, okay? We can work with any age. Now, there are some places that are comfortable working with children, or maybe they're only comfortable working after the child hits a certain age. Like maybe, well, our office only accepts patients after the age of 5 or 6, okay? That's not us. That's not what we do, but many offices do that. And that's just their comfort level, and that's okay. So any range for us in the younger years is definitely okay to work with. We can train their brains how to process vision better, and we do that through a series of using light therapy goggles and mechanically training the brain how to process vision better. And you'd be super surprised what you can do with children really at any age. Now, let's talk about the other end of the spectrum, okay? The twilight years, all right, our golden era. There are lots of times when people will say, well, am I too old to do this? No, you're not too old, because anybody can learn to have better vision. And just like, you can, I hate that saying, but let's just use it here because many people know it. All right, you can teach an old dog new tricks. All right, maybe that's not the best phrase to use, but it's something that we relate to because we've heard it a lot. The thing is that you're not too old. It doesn't matter if you are, in your someone might say they're in their 25, 25, and like, I've been told I'm too old. That's just ridiculous. No. If the person's 45, no, you're not too old. Okay, there is no such thing as like you have to correct this by the age of whatever, 7, or by the age of 2, or there's nothing that can be done. Those things are not true any longer, because what we know is the brain is what we call neuroplastic, which means it has the ability to learn new things and retain new information at any age. The only time we have to worry about something like that is if someone has gotten to the point where they've developed a condition that's affecting their brain's plasticity, like Alzheimer's or dementia. Okay, so even on the other end of the spectrum, when we talk about someone who's 70, 80, 90, anybody can have better vision. It can be trained at any age. There is no time frame of like, oops, you fell out of the window of getting it done by, 7 years of age or 18 or whatever. That does not exist, and it's not true. I wish doctors would quit saying it. However, unfortunately, they probably won't. It just means that you have to get more savvy and think, you know what, I'm going to keep looking for the answers for my vision and believe that the answer's out there no matter what age you are, whether you're young or whether you're older. I hope this helps. If you like the video, hit like, pass it on to someone else. You can subscribe to our YouTube channel. And if you're thinking, okay, well, since you said I'm not too old or my child's not too young, then maybe you want to contact us. If you're local, call us at 618-288-1489. If you're not local, which is out of state or out of country, then you can go to our website and do one of two things. You can either schedule consultation direct with me to discuss how we can help, or you can fill out the questionnaire, which is kind of a bit more of a learning process of what we can do to help you. But it ends in a consultation if you want to go that route. All right, again, like and subscribe to our channel. Thanks so much. Bye-bye.